Coma is a profound state of unconsciousness in which the patient does not respond and does not react to the stimuli of the surrounding environment. It is a nightmare that you cannot wake up from, trapped in a body over which you have no control. Already Hippocrates, considered the father of modern medicine, defined the coma as the corpse in lethargic sleep. Coma can be caused by brain injuries, such as severe head trauma, from a lack of oxygen, for example, during a heart attack or stroke, from severe alcohol poisoning or an overdose of drugs or medications, from a brain infection, such as encephalitis and meningitis. It can also be induced by the doctor himself using controlled doses of hypnotic drugs. And in this case, we speak of pharmacological coma or induced coma. And this is exactly what happens in the case of general anesthesia. Pharmacological coma serves to promote the healing process and to reduce pain sensitivity, for example, to counteract the swelling of the brain caused by a severe head injury. What happens to your body when you are in a coma? The answer depends on the severity of the coma the person is in. We'll talk more about it later. The person in a coma is unconscious and has minimal brain activity. They are alive but cannot be awakened and show no signs of awareness. Consciousness is shut down by interference in communication between the brainstem and the brain. There is an interruption between the cerebral cortex, where the gray matter resides, and neurons located in a structure of the brainstem called the reticular activation system. When an injury to one or both nerve components occurs, the person goes into a coma. Breathing, heart rate, and digestion are all functions controlled by the autonomic nervous system and may be able to continue on their own while the brain is in a coma. Other people, on the other hand, may need an artificial respirator, which is able to pump air into the lungs through a tube placed in the windpipe. The eyes are closed and numb to the surrounding environment. They don't move, they don't respond to pain, and basic reflexes, such as coughing and swallowing, are significantly reduced. In coma, normal body functions continue to work, hair and nails continue to grow, and a woman will still have her period. There are different levels of coma that are measured according to the Glasgow coma scale, a neurological rating scale that allows you to measure levels of consciousness, as well as to assess the evolution of the coma and predict its prognosis. 3 parameters are evaluated, which are scored based on the responses to stimuli. Eye-opening ability, verbal response to a verbal stimulus, motor response to a painful stimulus. The maximum score ranges from a minimum of 3 for the deepest coma to a maximum of 15 conscious patient. If a person is in a coma for an extended period of time, healthcare professionals will need to provide them with adequate supportive treatment in a hospital ward. This means that patients need to be fed and hydrated. They then need to be moved regularly so that they don't develop pressure sores. These are lesions to the skin with necrotic evolution due to long periods of immobility. At first, the wound looks like a redness, then it begins to push deeper and deeper until it reaches the bones. It is important to gently move the comatose patient's joints to prevent them from stiffening and the muscles from atrophying. Anything you say in front of a person in a coma could be heard. Research has suggested that stimulating the primary senses could potentially help a person recover from a coma. Some patients thus experience increased brain activity when they hear the voices of family members and loved ones. Hold her hand, let her listen to her favorite music, put some flowers in her room, or spray her favorite perfume. All of these behaviors could help the comatose patient heal. There are different types of coma, which are divided into 4 stages depending on the depth of the unconscious state. First stage coma. The patient responds to verbal and painful stimuli, opens his eyes, or makes sounds. It is a reversible state. Second stage coma. The patient does not respond to verbal stimuli, but only to painful stimuli. Second stage coma is also reversible, but recovery times are longer. Third stage coma. Coma characterized by the total absence of response to both verbal and painful stimuli. It can progress to brain death or be reversible. Fourth stage coma or irreversible coma. It is the deepest and most severe state of coma and is characterized by brain death, which means flat encephalogram. The brain injury is severe enough to cause brain death. The fourth stage of the coma is equivalent to the death of the person. The comatose state does not have a definite duration. It may take a few weeks, like months or years, or even never wake up again. The possibility of recovering from a coma depends on the severity of the brain injury, the cause, the patient's age, and the time spent in a comatose state. Over time, the person can gradually regain consciousness, or the comatose state can evolve into a vegetative state. That is that waking condition, characterized by unawareness of oneself and the surrounding environment. If the patient does not recover within 30 days, it is referred to as a persistent vegetative state. There are still many controversies today, both from a medical and legal point of view, as to whether this condition is irreversible or not. Once out of the coma, some patients return to a normal life, while others may manifest motor, sensory, and cognitive deficits, which unfortunately are not always reversible.